Emergencies don't wait, neither should you. Master life-saving moves from pressure bandages to heatstroke hacks, and learn how a plastic bag can be a first aid hero in this high-stakes crash course. A small number of diabetics can experience a rapid drop in blood sugar leading to unconsciousness, and you can help. But here's what most people do wrong: offering water or snacks won't work fast enough. The right move: give them something sweet, like a glucose tablet, right away. One glucose tablet typically starts raising blood sugar within 10 to 15 minutes, fast enough to prevent a seizure. If they are unconscious, never give them anything by mouth, call 911 immediately. According to the American Diabetes Association, quick action can prevent brain damage and save lives. And here's the kicker: if you wait too long, it could be too late. Know what to do, and share this with someone who matters. Every 40 seconds, someone in the US has a stroke. But some strokes can be reversed or minimized with prompt treatment, if you act in the first 5 minutes. Most people panic and wait, but waiting can mean permanent brain damage. Step 1: ask them to smile. If one side droops, that's a red flag, it's called fast. Step 2: ask them to raise both arms. If one arm drifts down, call 911 immediately. Step 3: listen to their speech. If it's slurred or strange, that's another fast sign. Acting quickly can improve outcomes, but specific claims about a 60% reduction in damage within 3 to 4 hours are not supported by the American Heart Association. And here's the kicker: you can practice the fast method anytime. It can help identify a stroke quickly. Every year, over 2 million people in the US suffer serious injuries from cuts and wounds, and most could have been treated at home with the right technique. But here's the problem: 2 out of 3 people apply pressure bandages too loosely, and that won't stop the bleeding. The right way: wrap the bandage tightly enough to slow blood flow, but not so tight it cuts off circulation. Apply steady pressure for at least 10 minutes, and don't lift the bandage to check the wound. If the bleeding doesn't stop, or the person feels numb or cold in that limb, call 911 immediately. And here's something surprising: you can use a rolled-up magazine or belt to maintain pressure if you don't have medical supplies. You never know when this could save a life, and now you're ready. Did you know tilting your head back during a nosebleed can actually be dangerous? Most people instinctively tilt their head back, but this can cause blood to flow into the throat, increasing the risk of choking. The correct first step is to pinch the soft part of the nose, right here, and hold it for 10 seconds. While pinching, lean your body slightly forward to keep blood from dripping into your throat. If bleeding doesn't stop after 10 minutes, or if the person feels dizzy or weak, call emergency services immediately. According to medical sources, most nosebleeds come from the front of the nose, not the back, making this simple technique effective for most cases. And here's the kicker: you don't need ice or pressure on the bridge. Just a paper towel and a deep breath can do the trick. Every year, over 200,000 people in the US suffer spinal injuries, and many are paralyzed because of one simple mistake. Most people try to move the injured person, but even a small shift can cause permanent damage. Instead, use 3 firm objects, like rolled towels or water bottles, to gently secure the head and neck. Keep the head aligned with the body. Even a 5-degree tilt can increase injury risk. If no first aid kit is available, use a backpack or folded blanket to create a makeshift backboard. Call 911 immediately, especially if the person is unconscious, in severe pain, or unable to move. And here's the kicker: you can stabilize a spinal injury with just a few household items. Most people don't know this. Every year, approximately 300,000 people in the US alone experience cardiac arrest outside of a hospital. Most bystanders don't know this simple life-saving trick. Many people try to help by leaning in close to give breaths. But that can put them at risk, especially if they are not wearing protective gear. Here's what to do. Grab a plastic grocery bag and cut off the bottom with scissors. Next, stretch the top of the bag over your mouth and nose, and secure the edges with tape to create a makeshift breathing shield. This creates a barrier that can protect both you and the person you're helping. It is not officially recommended by the American Heart Association for use in emergencies when no PPE is available. You can make this emergency breathing shield in under 30 seconds. And it could give someone the chance to survive until help arrives. Do you know CPR? Tag someone who needs to see this. And comment what first aid tip you want next. Every year, thousands of lives are lost due to delays in emergency response. What if you could change that in 10 seconds? Most people freeze or try to shake the person, but that wastes precious time. Seconds matter when someone stops breathing. The correct first step: tap their shoulder and ask, "Are you okay?" If there's no response in 10 seconds, call 911 immediately. While waiting for help, you can begin CPR. Starting chest compressions immediately can significantly improve someone's chances of survival. Every minute without CPR or defibrillation lowers survival chances by about 10%. Acting fast could be the difference between life and death. According to the American Heart Association, prompt CPR can double or even triple a person's chance of survival. Do you know CPR? Tag someone who needs to see this. And remember, 30 chest compressions could save a life. Every year, hundreds of people in the United States die from heat-related illnesses, and most of them could have been saved. When someone shows signs of heat stroke, confusion, hot dry skin, and a fast or weak pulse, time is critical. The first step is to move them to a shady area and remove any excess clothing to help their body cool down. Next, use water to wet their skin and fan them. This can lower their body temperature before emergency help arrives. Call 911 immediately if they stop responding or their breathing becomes shallow. These are signs of a medical emergency. And here's the shocking part: you can begin cooling them down right away, even before emergency services arrive. Do you know what to do in an emergency? Tag someone who needs to see this, and comment your favorite first aid tip. Every year, approximately 10,000 people are hospitalized due to heat-related emergencies in the United States alone, and it can happen in under 10 minutes if ignored. Most people panic and try to make the person sit up, but that can make things worse. Step 1. Keep them lying flat on their back to prevent blood from pooling in the legs. Step 2. Gently elevate their legs about 12 inches to help blood flow to the heart, but only if they are conscious and not injured. If they are breathing less than 6 times a minute, or not breathing at all, call 911 immediately. According to the American Red Cross, quick action can significantly improve survival rates. And here's the kicker: you can help just by keeping them warm and still. Do you know CPR? Tag someone who needs to see this. Every year, millions of people sprain their ankles, and most treat it the wrong way. Many just keep walking on it, thinking it's just a bruise, but that can make it worse. Step 1. Rest. Avoid putting weight on the ankle for the first 24 hours. It can cut swelling in half. Next, apply ice for 10 to 20 minutes every 2 to 3 hours. This prevents tissue damage and eases pain. Wrap it with an elastic bandage. Compression can help reduce swelling and support the ankle during recovery. Elevate your foot above heart level for the first 48 hours. It can reduce bruising by 70%. And yet, most people never do it, but it could save you from weeks of pain. Tag someone who needs to see this, and comment your favorite first aid tip. Did you know that using a cold pack wrong could actually make your injury worse? Leaving a cold pack on for more than 20 minutes can damage your skin and underlying tissue. The correct way is to apply it in intervals, 10 to 20 minutes on, and wait at least 30 to 40 minutes before reapplying. Many people use cold packs incorrectly in the first hour after an injury. Putting ice directly on bare skin can cause frostbite. Always wrap it in a thin cloth. Following these simple steps can reduce swelling and speed up recovery. Don't let a common mistake slow you down. And yet, most people still ice the wrong way. Are you one of them? Every year, around 300,000 sports-related concussions happen in the United States, and most are mismanaged. Did you know that even 10 minutes of screen time after a head injury can make symptoms worse? If you suspect a concussion, the first step is to stop all activity immediately. Watch for symptoms. Dizziness, confusion, or sensitivity to light may not appear for up to 30 minutes. And here's what you should never do. Give ibuprofen or other painkillers in the first 2 hours. They can hide serious symptoms. According to the American Academy of Pediatrics, an estimated 1.1 million to 1.9 million US children and teens are treated for a concussion each year. And most parents don't know how to respond. So what should you do? Rest? Watch? Wait? And if symptoms get worse, call 911. You could save a life. Did you know using ice wrong can actually make swelling worse? Let's fix that. Most people just slap ice directly on the skin, but that can cause frostbite and do little to reduce swelling. Wrap the ice in a cloth and apply it for 15-20 minutes at a time to reduce swelling effectively. Repeat every 2-3 hours for the first 24-48 hours after injury for best results. Cold therapy can help reduce inflammation if done correctly within the first hour. Never apply ice directly to the skin. Always use a cloth barrier to avoid frostbite and irritation. Did you know this before? Tag someone who needs to learn this life-saving tip. Every year, around 150,000 new cases of epilepsy are diagnosed in the US. You might be tempted to hold them down, but that can cause 30% more injuries. Step 1. Clear the area of sharp objects. This can help prevent many common injuries. Step 2. Gently turn them onto their side. This helps keep their airway clear. Time the seizure. If it lasts more than 5 minutes, it's a medical emergency. According to the Red Cross, calling 911 immediately can significantly improve outcomes. And here's the kicker, most people don't even know to time the seizure. What would you do? Did you know approximately 12.7% of strokes are missed in the first hour? Most people ignore subtle signs, like a drooping face or slurred speech, thinking it's just a bad day. Here's what to do. Ask the person to smile, raise both arms, and say a simple sentence. If one side of their face doesn't move, or one arm drifts down, it's a sign of a stroke. Call emergency services immediately. The faster you act, the better the outcome. Every minute a stroke goes untreated, thousands of brain cells can be damaged or die, and many people may not recognize all the signs of a stroke. You just did. Now you're in that 30%. Share this with someone who needs to know.